How many operating rooms do you have here?
So we have 6 operating rooms.
It should be busy in these hallways. Dr. Gary Weinberg is the chief of surgery at Cornwall Community Hospital. Right now, only one of his operating rooms is running. With Ontario postponing elective surgeries, 5 operating rooms are empty.
Well, it's horrible. You know, it's 1:20 in the afternoon right now. Normally this room should be full of hustle and bustle, patients getting the care they need.
All right, just relax your arm there.
Now, Weinberg says shutting down was like cutting off an arm to save the rest of the body. Very hard choices had to be made. The staff was needed in other parts of the hospital to keep it going. The acute medicine unit would normally have 12 nurses. They've had days where 5 were off sick with COVID. That's a patient-to-nurse ratio the director of the department calls unsafe.
It has reached that level. Knock on wood, we're not there this week. You know what, I'm going to check your chart.
Right now in the hospital, 38 staff members are off sick. The rest have already had COVID, or basically they're waiting to get it for the first time.
I've been sick. A lot of my coworkers have been sick.
To take some of the burden off people like Nurse Kelly Lozo, for the last few weeks the hospital has redeployed staff that would normally be working off-site. This woman's not a nurse, she's a warehouse worker. The extra hands were needed that desperately.
You know, we're going into year 3 now of this. Exhausting. Doesn't seem like there's any end in sight.
Pre-pandemic, the CCH already ran near or over capacity. It used to have 156 beds, it's added 22. It literally says it over the door.
Yes, this is
The auditorium isn't an auditorium right now. It holds 11 patients.
There's no place to bed space them anywhere else.
Yeah.
There's a struggle in intensive care as well. This 5th wave has been the toughest.
So right now we're at 13 patients admitted to a 12-bed unit. So we're over capacity every day. It's been like this way the last few weeks.
There are days where every single patient in this ICU is here due to COVID, and the unvaccinated are overrepresented. One nurse told us she'd like to give some sort of COVID tours so people could see what's going on, but it would be too dangerous for people to visit where she works every day. Mike Armstrong, Global News, Cornwall, Ontario.